is another video packed with information that will help you if you are already in the United States or you plan to move to the United States as a healthcare worker. Of course, you know that if you have family or if you move with your family to the United States or anywhere abroad and you have children, you know how difficult and challenging we find it. But our people are making it possible that we can work from home and well and still have the time to look after our family members. You know, when you move abroad, information will make so many things easier. So information, they say, is power, and this is one of those videos that you watch and information you get can change your life. Now, this company that I'm going to be interviewing today, I know one of them you have seen before, but this other one you have not seen. They are changing the game for nurses, for healthcare workers who are already in the United States. And if you're not in the United States, don't worry, because this information may change your life if you have the plan to do so. Because I know many people who watch this channel, is either they are in the United States, in the United Kingdom, or they plan to move. So I believe that this information will benefit you anyway, and I encourage you to watch to the very end so you hear from the horse's mouth. Get on this. You know, I'm doing an advanced degree in the United States and I'm like, oh my God, I wish I heard about this earlier, no, but I know it's, you know, it's not late. But this is very, very helpful. If you want to work from home as a nurse, this is an opportunity for you. If you want to work from home as a healthcare worker, a doctor, you want to get on this, okay? And
all right, thank you, Lynda. Thank you for the opportunity to be here. Just like she said, my name is Dr. Wale, and I'm a medical doctor from Nigeria, and I've been working as a clinical documentation specialist for more than 2 years right now. And the opportunity I want to talk to us about today is clinical documentation specialist. And I'm sure a lot of nurses, doctors, you've heard about CDI, CDS. Sometimes they refer to it as CDS, and people say, what is CDI? What is clinical documentation? Sometimes they will refer to it as clinical documentation improvement. Sometimes you hear it as clinical documentation integrity, or sometimes you actually see it being referred to as clinical documentation specialist. So what does it entail? So basically, you have what is expected when it comes to medical coding. There's a language that medical coding wants the doctor to use, but there's a way providers document. There's a difference. So what the CDI does is to bridge that gap, to make sure that what the providers are documenting is in accordance to the language that medical coding wants the doctor to use. Then apart from that, we also ensure that what is documented perfectly represents the severity of the patient's condition. For example, if the doctor says a patient has hypoxia, and if the doctor says the patient has acute respiratory failure, you can see that one represents the severity of the condition much more than the first one. So that is one of the things that CDI does. You go through medical records and you ensure that what is documented accurately represents the severity of the patient's condition. Now, let me quickly jump into why is CDI important? Like, why do hospitals need CDS? And one of the first reasons is that you want to represent how the kind of severe patients that you're seeing. How severe are your patients? And the severity of patients also determines the quality of care you give to this patient. Because if, for example, you believe that your patient has a severity rating, for example, of 2, you're going to give that patient the care of a severity of 2. But if the severity is appropriately represented as 3 or 4, then the kind of care, the kind of monitoring you give to this patient would also change. So when hospitals have CDS, it kind of ensures that the hospital quality ratings, the kind of care they deliver to patients is improved. So CDS ensures that. Then apart from that, the role of the CDI is also important in reimbursement. You know, no hospital wants to lose money. And the way payment is processed in hospital setting is if you treat a patient for 3 conditions and you only documented 1, then you're only going to get paid for 1. So the clinical documentation specialist also ensures that every condition that is treated is properly documented. So then I think another thing that we do is also that we help with reducing the rate of denials because we ensure accuracy of diagnosis. If a doctor has documented one diagnosis, we want to make sure that that diagnosis actually meets the clinical criteria of that medical condition, so that you don't say you are billing for a condition only to find out weeks ahead that the payers are going to deny it. So it's better to already address it at an early stage and make sure that the conditions that you're billing for are actually supported clinically. But that's a summary of what CDI does.
Oh, wow. Thank you so much for that explanation.
Thank you for that question. You couldn't have asked it any better, because every time I get questions like this, can nurses do it? Is it only for doctors? And the question is yes, nurses can do it. I'll even go a step further and say that we have more nurses doing clinical documentation specialists than doctors. Like, in fact, most places, the ratio is usually about 80 to 90% of nurses. So I would start by saying, if you're a nurse and you are considering maybe doing something different from bedside, and you love pathophysiology, you love accurate documentation, then you might want to consider a clinical documentation specialist. One of the perks of clinical documentation specialist is also that a lot of the positions that are available are actually remote based. So if you're somebody that you don't want to be restricted to the looking for a job in the environment where you live in, then you can consider CDS as well, because most jobs are remote. So you can be staying in Texas and then you go get a job in Ohio or somewhere else all over the country. So CDS has that advantage as well. Now, with respect to qualification, the fact that you're a registered nurse already qualifies you to work as a clinical documentation specialist, because you have the clinical experience. Now, one of the things with this field is that it's a little bit niche. It's niche because they want to be sure that you understand medical coding language, you understand the requirements, things like DRG and the likes. So it's very difficult to just bring somebody who's been working on the floor and say, okay, start working in clinical documentation specialist. So they usually want somebody who understands, who has a little bit of background knowledge. And one of the best ways that you can show that you have background knowledge is to have the certification. Now, there are two main types of certifications that you can have. The first one is what is called the CDIP, which stands for Clinical Documentation Improvement Practitioner. And there's another one that is CCDS, which is also Clinical Documentation Specialist certification. Now, CCDS takes a long time to get because you need to have been working in the CDI role for about 2 years before you can go for that certification. But for CDIP, being a registered nurse, you can already go ahead and apply for the certification examination. Now, of course, there's a lot of things to do. There's a lot of reading to do. And one of the reasons why I decided to talk about this position right now is that I discovered that over the last 2 years, I have worked with a lot of nurses and doctors, especially a lot more nurses than doctors, who wanted to get out of bedside. I helped them through with the course, like these are friends, families, these are people, referrals from like third party who came to say, look, Dr. Wale, I want to get out of bedside. What can I do? And I say, have you heard about CDI? And I gave them materials. I walked them through materials, did personal teaching sections with them. And these people went on to get the certification, and not just get the certifications, they were able to get interviews, they aced their interviews, and they got CDI positions. So as a nurse, if you're interested in CDI, it is very possible. All you need to do is to just decide you want to do it and register for the exam, get the preparatory materials, and yes, and you'll be ready to go. That's the thing with getting to the CDI field.
Okay, thank you so much for that.
I also want to quickly add, when you asked about how easy or how difficult is it to get into CDI, let me just include the fact that one of the things that we do at our training center is that we would help to prepare you for interviews, because the fact that you have the CDI certification is not enough to get a job. Most times when you get invited to interviews, they want to know how well can you actually do record reviews. Like if they give you a patient review, they want to know, can you actually review it? Can you do a good job? Or do we need to hold your hands for the next 6 months before you can do that? And that's one of the things we'll also be working with you on. So apart from helping you to pass the exam, we'll make sure that you know the right tools. We'll teach you how to do record review and how to also answer the interview so that the recruiters will be impressed and you'll be able to land your desired CDI job.
Oh, okay. So that's really, really good.
Yeah, thank you very much. My name is Decency, and I just feel like I'm already in the class session having this clinical documentation improvement class because Dr. Wole just went into it and gave us every detail that you need to know about it. So one of the other things I want to mention about clinical documentation improvement specialist is this is actually an area of nursing that is not so much crowded. I wouldn't say an area of nursing, but an area of healthcare that is not so much crowded. There's a lot of just a few people who are privileged to have this information, and those who know the value of this information are, currently going into it. I know it's a new area. People are scared of doing new things, but it's also very rewarding. And we've seen that in the lives of the people like Dr. Wole and other people that we know that have done these courses through him. Is been rewarding for all of them. They all quit their bedside nursing jobs and they are full-time CDI practitioners. And that's one of the things that so many people have been asking themselves: when will I continue to work this bedside nursing till? Am I going to continue doing this? Because the pressure from work, there's a lot that goes on in that space. And then if you bring that that peaceful nature of just being at your home and doing things from the comfort of your home, it takes away a lot of stress from you. And then not to talk about the extra income that this program also bring. And then the more you stay on the program, the more rewarding it will be because you'll be more employable and then you'll be able to get more high paying jobs. I've seen actually more jobs that pay as high as 75 for an hour for clinical documentations, but it depends on location, just like Dr. Wole said. So just to mention, the way to join us in this program is to send us an email at admin@noveltrainingservices.com, admin@noveltrainingservices.com, or you give us a call 346-370-7111. So once we're able to get your information, we will be corresponding with you with all the details that you need to know about our next start dates, our next cohorts, and then the class materials and most of the things that you need to have about this program. And one of the things that we try to do is to make sure that when you come into the program, you leave with your certification. So we are not just coming to train you and leave you just to go like that. When you come into the program, we ensure that you register for the certification. And then we also watch you prepare for that certification and watch you pass the exam. So it's just like we are guaranteeing that with your support, with your full concentration in the program, we will be able to ensure that you pass the CDI program. And once you pass that exam, the next thing is to start your LinkedIn optimization, making sure that you're visible to employers and to recruiters so that they'll be able to see you and even be the one to contact you. I've seen a lot of people who just went on LinkedIn and updated their profiles stating that they are now CDI specialists, and recruiters were the one reaching out to them, telling them we want to hire you, we want to employ you because this area is an area that we don't have a lot of people in. So that's just a little, it's a bit of a much more introduction, but it's just a little way of saying what this program stands for and what we do currently.
If you want to, I'm going to leave their information in the description of this video. Before we go, I would just want to ask Dr. Wole to give us like a piece of advice. So if you're a nurse watching right now, or maybe a doctor watching right now, and you want to go into this space, because I believe like a lot of things are being done online these days. Is there a particular thing you want to share with us that will help our career or anything?
I think what I can say, final words, will be that if you're thinking about getting out of bedside, then send an email today. let us get you into the next batch of trainings that we want to do. And the earlier, the better, because we would be we're able to get you ready for a CDI within 4 to 5 weeks. That is one thing we've been doing, and the earlier you get into it, the better. So I'll say send us an email today and let us see how quickly we can book you into one of our training sessions.
Okay, thank you so much. I really enjoyed this session because this is new to me as well. So I have learned a lot, and I believe that any of us that decide to join this program, just like Mr. Dicent said, he has also mentioned, Dr. Wale mentioned, it's going to really be helpful, because I know a lot of people want to have options instead of working in bedside. Do I still have something that is rewarding that I can do from home? So I really love that we have this opportunity today, and many more of this coming out for nurses too. So thank you so much for joining me today. And